So be diagnosed, get into care, and stay in care are the top 3 reasons and the top 3 things people can do to stay hopeful and engage in their health. I am the founder and president of the Impulse Group. Impulse Group is a volunteer global movement for gay men to prevent HIV and also dealing with mental health issues.
I'm a licensed marriage and family therapist, and I've been working in the field of behavioral health and HIV for the last 19 years.
Other things that give me hope are the education I see happening in our community. I work as a therapist. My specialization is in LGBT psychology. Currently, I work primarily with clients who are HIV positive.
I'm the director for the Los Angeles Family AIDS Network.
The best thing people can do when they meet somebody who's newly diagnosed is get educated. Stop using stigmatizing comments, right? HIV is not for gay people only. HIV is not a punishment from God for doing A, B, or C. I think there's still a lot of conversations like that. So we need to just understand the reality and stop with these myths that don't exist.
Just listen to the person, let them process. Remember, they're the ones who have the diagnosis, right?
Don't try to fix it right away, because they might not need fixing. They might just need somebody to talk to.
And find out how to be supportive. So for example, in a lot of clinics, like the one I'm in and other service providing places for clients who are HIV positive, they offer those services. Like families can come in and they can ask questions to me. So what does it mean that my son has an HIV diagnosis? Is he gonna have a long life? Is he gonna be healthy? Are we safe around him? It's really important to provide information to people so they can put it in context and focus on what really matters, which is keeping the person who actually has a diagnosis healthy, feeling loved and safe with the people who are closest to them.
I think the simple fact that someone wants to engage somebody who is living with HIV is wonderful. Offering support is critical. But the ways in which we offer support is equally as critical. So when we have someone who receives a message, whether it's text or a virtual hug, it's amazing. But how about taking it a few steps further? How about asking, how are you doing today? How is your journey, right? So we have different levels for individuals who are living with HIV. So is someone early in their diagnosis? Is it later on, or is it, now someone who's living for a really long time? And as we move in the journey of somebody with HIV, it's how do you thrive with it? How do you learn to live with it and help it kind of just be managed while at the same time living your life in the best possible way?
First, they have to be diagnosed. They have to go to a medical facility, their doctors, anyone, and make sure that they're diagnosed. After they're diagnosed, they have to get linked into care. That is the biggest gap in our fight with HIV is once people get diagnosed, many of them, 40% of all Americans diagnosed, are not in treatment, which baffles me because we have the medication, whether you have money or not, there's ways to get medication. So being in treatment is crucial. And lastly, is staying in care. If people drop out of care, their HIV virus becomes immune to that medication, and it's not a good thing. So be diagnosed, get into care, and stay in care are the top 3 reasons and the top 3 things people can do to stay hopeful and engage in their health.
Other things that give me hope are the education I see happening in our community via some in schools, but also from clinics, also from publicity campaigns, giving people actual information about HIV. That's again the most important part. People talking with each other, building community, learning how to support each other in a way that is non-judgmental, not based on ignorance. I think those are some of the bigger advancements I'm seeing that I think we have to value just as much as medication.
There's a lot of hope for people living with HIV, given the fact that there's, going back to the science, that there's medications that now it comes down to you can take 1 pill a day that can get you to an undetectable viral load, which is, really the outcome that we want to see on the health side is having people with undetectable viral loads. The other science that we're seeing is around pre-exposure prophylaxis, and so also having the protection of somebody who may want to be in a relationship with someone who's living with HIV, or who have partners where they don't know their HIV status, and being able to take this preventative medication to keep them healthy and from, keep them safe from contracting HIV.
Some of the most reliable ways to get tested here in LA County, and again, I think briefly I just want to say, outside of LA County and across the country, things are different. Testing may not be as accessible, but here in Los Angeles County, there are a variety of clinics and locations where you can go get tested for HIV. You can get tested anonymously. There are also mobile units, so that means it's a truck that goes around, will park in different places in the community, and people can get tested. There's Ultimate Health Services, which is kind of throughout Los Angeles County, East LA, South LA, and a variety of locations. There's the LA LGBT Center, AIDS Healthcare Foundation, Bienestar. I mean, I could kind of go on, but again, if you just even Google HIV testing in Los Angeles County, a variety of resources should pop up.
And so if someone is living with HIV, we certainly want them to get tested early on. We want them to be aware of their diagnosis, and we also want them to know that they're not alone. We have over 1 million individuals here in the US who are HIV positive and who are thriving.
What gives me the most hope about HIV treatment is that we have the cure. I do strongly believe that we have it out there, or that it's coming. So I'm hopeful that HIV in 10 years will be the history of the 80s.